everybody. I'm Angela Hart, and welcome to the show. We're holding a televised panel discussion series with people who are giving back to the senior community. And so I've invited the guests on to share with us their views and their experience, especially for caregivers and seniors. And I've invited my co-host, Eli Goldbaum. Eli manages nursing homes and deals with caregivers all the time. He works closely with home health care agencies. He has counseled thousands of caregivers regarding senior care financial issues, and he's a Medicaid enrollment and eligibility expert, and for over 20 years. So welcome to the show, Eli. Thanks for co-hosting.
Thank you, Angela. I appreciate it, and thank you for having me back on the show.
This is the second time Eli's been with us, and we're learning each time he comes on about ways that we can help caregivers and seniors deal with Medicaid, long-term care, nursing home, all the issues that are facing so many families these days. The other panel members are from Centers Healthcare, a not-for-profit post-acute organization. One of the largest post-acute health care centers in the Northeast they have. It includes more than 30 skilled nursing and rehabilitation facilities, 4 home health care companies. They operate 8 adult daycare centers, 2 renal dialysis centers, 2 assisted living facilities, several urgent care walk-in centers, and they serve as Medicare and Medicaid management company. So these people know all about senior care, and I'm really privileged and honored to have them on as our guests. Centers Healthcare provides for the needs of over 5,000 short and long-term residents. So what excites me the most is that they're actively pioneering to implement more services for seniors so that they live their life to the fullest, whether they're at home or whether they're in the nursing home. And this is what we're going to learn more about today. So I'd like to introduce David Greenberg. He's an administrator of one of the nursing homes in Borough Park in Brooklyn. Welcome. It's so good to have you here, David.
Thank you so much for having us. It's a pleasure to be here.
Thank you. Thank you so much. And Steve Carr, he's the Director of Sales for the Healthcare Centers, right?
Thank you. It's great to be here. Look forward to the episode.
We're going to learn more about from you how you're dealing with when you deal with the actual patients directly, because you're dealing with the family. You're probably the face of the healthcare center. So
on most days, absolutely.
Just most days. So why don't you tell us, David is going to help us with the debunking the nursing home myth. And let's share some of these with the viewers, if you would. There's a bunch of myths out there. We have preconceptions about what's involved with nursing homes, and I bet you could tell us a lot more.
Sure. I mean, when people first think of or first confront it with the idea of needing a nursing home, David and I know that's never easy for them to swallow. It's very rare that we ever have someone knock on our door excited to be moving into our facility. But that's before they really understand why they're there. And so ultimately, what we try to do with customers and patients and family members is help them understand that over the last 20 years specifically, healthcare in this country has evolved to a whole different level in the way that healthcare is delivered. And the days of long, week-long or beyond that, as far as hospital length of stays go, are gone. Those long hospital length of stays are no longer. And so the question we always ask is are patients dramatically healthier today than they were 25 years ago? Or is it really that the system has changed? And now there's other providers like nursing homes that are being asked to actually step in and provide the rehab part of the recovery. And so what we like to help patients and families understand is that when a doctor recommends the next step as a nursing home stay, that's not necessarily a bad thing. Certainly not the way it was envisioned 25 years ago. It really is the next step in recovery of getting home and being able to get back to an active lifestyle for most patients.
Did you just say that a nursing home can sometimes be the first step before sending a person back into the community? Did I hear that right?
Absolutely. The bulk of specifically the facility that David runs, we see, David, 100, 150 patients a month that they may come and leave back home into the community to a much more active lifestyle.
Well, this is very interesting because my mother-in-law had been admitted to a nursing home for rehab, as like what you're describing. And that particular nursing home we found was not very assertive about her rehab procedures and program. So I'm glad to hear that that's really what the goal. We kept saying, we want her home. We want her back home again. So I'm glad that the way your organization functions is to get the people back home again.
Absolutely. I mean, most of the patients that we admit they begin with a hospital stay. The patient is in there for 2-3 days, sometimes 4 at the most.
Really?
social workers come in, physicians come in, and they say to the family and to the patient, you're going to be discharged within the next 2 hours. And at that point, for most patients and most families, it's earth-shattering. They did not anticipate needing to go to a nursing home for care, and again, for most people, it's a very, very onerous task of trying to come to grips with that. But I think there are many things that families and patients can do to make sure that they're more prepared and more comfortable with that decision.
I was saying, Angela, we have this on a daily basis. I meet with people, and I find that people have this thought that a hospital is a place that they used to get the rehabilitation, because that was the way it was years ago. That has all changed, and I think that's really what Steve is saying, how things have changed and evolved in the industry over the last 20 years, that you're not getting your care any longer in a hospital setting, but they move into a nursing home setting for the short-term rehab. Sometimes they actually stay in the long-term as the way it was in a nursing home, but for the most part, that's the transition. And then, as you were saying, there are people that eventually will transition out of the short-term rehab back into the community, and I think that's what this panel really has to offer, as far as to understand the care.
Thank you. And I know that the caregivers have to deal with the fact that people require different needs, and so how do you deal with that as a professional?
So just to piggyback on what Steve was saying and what Ellie was saying as well, is that today, the long-term care setting, the nursing home setting, is not what you may have seen 25, 30 years ago on a television show or in a movie. Today, really, nursing homes are rehabilitation centers. We're the first people to get a phone call after, a 3 or 4 day hospital stay, and, a lot of family members come to us bewildered. They're not sure exactly what's happening, what's transpiring, and they come into our doors in our industry, and they see that, that nursing home that they may have thought was, a place where old people went is really a place of life at this point. Mm-hmm. There is, at any given time, in our industry, almost half of the facility is doing what they call short-term rehab, sending people back into the community, because we understand, we know that the best place for a resident would be back in their own home. Unfortunately, sometimes the home setting is not, it's not where they need to be, where they can be at this point. So they wind up coming to us. They spend 5 days, 10 days, 20 days, maybe even a few months, and where they get this constant rehab, this constant support, whether it's emotionally, spiritually, and we're there then to be able to send them back to the community. And those are considered the best way to provide, care today, is to send people back to the community.
Yeah, but they're not always ready. The problem is, like what we had with Mom, is that she wasn't really ready to be back home alone. We weren't home, we were out working, so how do you deal with that?
So thankfully, in our industry, we have tremendous caregivers. We have different departments, whether they be rehabilitation department, the social services department, and they work hand in hand with the doctor, with the nurses, with the team to decide where is the best place, when are they able to go home, when can discharge happen. If discharge is not ready, then we prolong the stay a little bit longer where the need is. But most of the time now, we're sending people home. I know that in the facilities that Centers deals with, we have almost 30 to 40% of our population winds up going back into the community.
But what must the family, how do we deal with that? I mean, we had to call agencies, and we were kind of lost in the shuffle. We weren't really sure what to do at that point. Do you have any good advice for families?
I think that's important. I think David and Steve Moore are dealing with the nursing home. I mean, Steve actually maybe not, but they're dealing with the nursing home industry. But this is a lot larger than just the nursing home industry. We're talking about home care. There's a major problem that people have when I think David actually alluded to it. He said, if the person stayed in the hospital 3-4 days. People don't realize that you're required to have a 3-day hospital stay before you enter into a nursing home for Medicare to cover the stay. And that's something that a lot of people don't realize. And if you only have a 2-day hospital stay, now all of a sudden you come into a nursing home and you have a problem with a payer source. But even beyond that, it's nice to say I'd like to stay in the nursing home longer. Years ago, it was much simpler to stay in the nursing home longer. People had traditional Medicaid. Medicare paid a certain period of time. Medicaid paid a certain amount of time. At this point, Medicaid, as we call it, the fee-for-service Medicaid, which was sort of a person had Medicaid, was good to go. A lot of the Medicaid is transitioning into HMO Medicaids, different types of Medicaid products that have, people may have heard, MLDCs, Medicaid managed plans, there's HMO managed plans, there's regular HMOs, there's, so people are just totally confused.
Well, wait a second. So what do we do then if they're they're in a nursing home and they may have to get care, and you're talking about managed long-term care, MLTCs. So how does a patient get on that, and what does the family do about that?
So, there's a lot of confusion out there, and I think that really takes us a step back. We were sort of talking about this before. A person, the typical viewer out there will say, this doesn't either pertain to me, or what typically happens is that something happens all of a sudden overnight, and it's mom or dad, whoever it may be in the family, and now they're thrown into the healthcare situation of they are in a hospital, they find themselves in a hospital, mom had a fall,
Yes,
she may have had a
yes.
stroke, and all of a sudden, gee, what happens? And they always had this thing in their head, I'm never putting my mother into
Right,
a nursing home,
right,
which
right.
we hear all the time. And they're finding out there's no more nursing homes. They're all called rehabilitation centers. So typically, they'll end up going into a rehab center. And within the rehab centers, there are different floors typically in the average center, where some of them are the short-term floors and some are the long-term floors that David was alluding to. And I think he actually could speak a lot, more toward that as far as the nursing home perspective of the different types of services that you can get on the different floors, and how they actually at that point, and maybe I'll turn it over to David to allow it, how at that point the person would, I guess, work with their case managers, whoever it is, to figure out what's the next step, and then eventually, we could talk about the payer sources.
It's overwhelming for
Yeah.
families.
Like we said, no one is yippee, I'm going into a nursing home. That's the last thing that they really say. But once they enter and they start their rehabilitation, there are many departments to navigate with the family members, with the resident themselves, to decide what would be the best care possible. Unfortunately, sometimes people do have to stay long-term in a facility. When that happens, they meet with the caseworkers, they meet with the nursing department, and they decide what would be the best plan of care for them. We meet with a multidisciplinary team where we sit down with the family member, with the doctor, with the nurses. It's a team approach to decide where's mom, where's the best place for mom. Different floors, different roommates, different doctors, different nurses, and we constantly keep on changing, constantly keep on tweaking to make sure that this is going to be the best possible state for mom and dad. This would be the best possible thing. And we constantly have input from the family members. We constantly have input from the caregivers to see what would be best for mom and dad in this situation.
Well, maybe I guess, Steve, how would if I'm a person in the community, I'm in the hospital, my mother, whatever it is, in the hospital, now all of a sudden we're told you have X amount of time, and my understanding it's like a day or so
Yep.
to find a nursing home. So how do I decide? David was saying we have different floors and whatnot that does different type of cares. How do I choose nursing home A over nursing home B?
Yeah, it's a question that really weighs heavy on most family members and patients that have to make that decision. And I think there's a couple things. Number one, the amount of patients that are sent specifically from hospitals in the New York City area to skilled nursing facilities is in the thousands per month. And I think that's good for the community to realize that the social workers and the care managers in the hospitals, they understand, they connect with many of the nursing homes in the city and work on that every day. Once they provide you with the guidance that a nursing home is going to be the next step, I think the most important thing that family members and patients need to ask themselves is, what is it that I need right now? Is it a long-term care situation? That's a more permanent stay? Is it a short-term rehab so I can get back to my lifestyle within days or weeks?
I find I deal with a lot of clients. I hear this all the time. We thought it's going to be short-term,
Yep.
and it ends up being long-term. There are things that you don't always
Absolutely.
know at the time of the
Yeah.
discharge.
Yeah, in medicine, we have not invented the crystal ball yet,
No.
that's for sure.
But what's most common? Is it most common that they stay in the nursing home, or that they get back into the home,
Yeah,
their own home?
in this day and age, most of the admissions that facilities in the greater New York City area are asked to care for are patients coming right from the hospital. Again, it's in the thousands per month
To the nursing home?
to the nursing home.
Or the
It's-
rehab? But
the-
then
to the
from
rehab.
rehab, do they usually stay at the nursing home, or do they usually get discharged?
I would really say that's dependent on the facility. Dependent on the facility.
Why? Why is it?
There are some that do a little bit more, some facilities do a little bit more subacute rehab. That would be, the majority is rehabilitation, and then they wind up going home. There's some facilities that only do subacute rehab, and then there's some facilities that have a very small percentage of subacute rehab, and then, more of long-term care.
Okay, so I looked up acute, subacute today, because, so for the viewers, can you share what that means? Because people
Yeah.
who aren't in the industry really don't know, and I cannot even articulate it best.
Right.
Yeah, so acute level of care is the hospital. It's the level of care that most people can associate with. They know what a hospital does. Subacute really refers to a level of care below a hospital, and that's typically the first level below a hospital would be a
Such
nursing
as,
facility.
An emergency room visit?
No,
a
no,
walk-in, what do you mean?
typically outside of the hospital, typically in the form of either a nursing rehab facility, a skilled nursing facility, or in some cases, home health. I mean, there's some home health agencies that
Okay.
you'll also deliver a high level of care. But ultimately, I think that the family, I mean, to David's point, there are different, it's not one shoe fits all. There's different solutions, and we're blessed in this market to have facilities, all throughout the area that deliver everything from specialties in Alzheimer's care to stroke recovery to cardiac care. And I think it's important to realize that it is not. It may not be the nursing home that's in your neighborhood. There could be an Alzheimer care unit that's in the neighborhood next door to yours that has the greatest level of experience in delivering that care. And ultimately, there is no substitute for experience, in my opinion. I think that family members should seek out the facilities that have the most experience dealing with the needs that their loved one or they themselves as the patient have at that time.
And so sometimes it's dementia, but it could be even physical,
Absolutely.
or maybe that is
Yep.
considered physical, but.
Do people typically take tours of a facility prior to?
So what we recommend also is that to be a consumer, unfortunately, a lot of people are thrown into this. Mom fell in the house and, never believing that they were going to wind up even in the hospital. There's a hip fracture, and then 2-3 days later, there's a caseworker in the hospital that says, you know what, here are five nursing homes in this area, go quickly and, choose one. And unfortunately, it becomes a very, very quick process. And we just believe that, an educated consumer is probably, that would be the best interest of the family member and then the resident. So I would really recommend that, family members, once they get to the hospital and they're given that list of, here, go out and seek, go to the facility, go and, spend some time in the facility, a few hours, walk around, knock on the administrator's door, speak to the director of nurses, go look at what the rehab gym looks like. Very important to walk the whole, that there should be full transparency of all these rehabilitation centers so that you could feel comfortable. Because ultimately, you are going to be part of the solution. We look at it that it's the resident, it's the family member, and it's the staff. And it's almost like a triangle. And when you have those three working hand in hand, then you have, tremendous outcomes. And it's important, like I said, to go into these facilities, see what's going on, and speak to everybody. Because you wouldn't buy a car without going to the dealership. You wouldn't select a school for your child without actually speaking to the teachers and speaking to the principals. The same thing holds true with the rehabilitation center.
Yep.
And that's what our industry is all about today.
Yep, absolutely.
We had personal experience similar to that because we were given a list in the hospital of a few nursing homes in the area. And my husband went driving around and he said, thank God I didn't go to the one I thought we were going to go to. I didn't even want to go through the front door when I arrived at the property.
Right.
It was so, it wasn't well maintained and it was just, he didn't have a good feeling about it. And conversely, he visited other ones that he got a much warmer, friendly feeling about, and they turned out to be a lot better. So this guest is absolutely right that we should take time. This is not about buying a car. It's about a family member we're talking about, and we should really take time, even though we're all working who are caregivers to our elderly parents. We should take time to at least visit a facility, and as you said, see how transparent they are, how accessible they are with the administrators, and see about the physical therapy room. These are all good points. Thank you.
There's a lot of things going on now behind the doors of our rehabilitation centers. There are concerts that go on. There are, cookie baking. There's rehabilitation happening, and these things are happening, from 7 a.m. till 10 p.m.
Yeah.
It's a life center, and, it's something that, again, you have to really see and experience to understand what we're trying to do. Because unfortunately, there are going to be negative times that you're going to drive down, you're going to see that facility, it may have had a scent to it or something like that. But thankfully, our industry, and for the consumers out there, our industry there's so much oversight that it's kind of hard, at this point.
Nowadays.
To have, when you walk into the lobby, to have a scent coming from.
I actually, I go to a lot of facilities. This is part of my job. I walk, I go to different facilities, and it's interesting how things have evolved over the years. I started this business in 1987. It's hard to believe. When I started the first nursing home that I worked for, it was a 200-bed nursing home.
Is that
nur-
considered big or small these days?
200 beds probably
Average?
average in the city of New York. We were doing at that time maybe 80, 90 admissions a year, which means about 80, 90 discharges a year. That same facility, without being aggressive, today is probably doing 400 or 500 admissions and discharges. If they're aggressive, they're looking close to 1,000. So it's a totally different industry.
They're spinning them out back
That-
home.
That's correct. A lot of
Wow.
them are going back home. There is also a new thing that's not really the show for, but we'll talk about the reimbursement to the hospital. And I think that also draws a lot of the patients out. We're talking about this idea of why is it that I'm giving a message today, tomorrow find yourself another nursing home. So one of the things that is happening is the reimbursement at a hospital is changing dramatically. And once a certain point comes, they're no longer getting reimbursed for you
From
to
the
be in the
insurance
hospital.
company. So it is about
they
money, in all
need you-
fairness,
That's
yes.
correct. So they need you out of the hospital yesterday. And that's why you're really given very little time to make those decisions. They're actually being penalized, they're going to start to be penalized for readmissions back into to the hospital from the nursing homes. So what ends up happening is it sort of forces, and I guess you guys could speak about it a little more, it sort of forces the nursing homes to really do a good job, not like it used to be, where years ago, it was sort of like, oh, the patient spiked a fever, throw him back into the hospital. That's no longer the case, and that really helps the viewer understand. It forces the nursing homes to really do a much better job so that they don't end up
Back in the
going back
hospital.
into the
Oh,
hospital.
this is
So-
excellent. This is
Yeah,
excellent,
absolutely.
actually, so.
Yeah, I mean, the way that I think hospitals, physicians, and certainly those of us in the nursing home industry look at every patient now is it's a responsibility to manage the care for that patient for at least 90 days, to keep control of that patient's destiny for 90 days, where, even 5 years ago, we were worried about, can we get this patient in, can we get them home, and that's it. And in this day and age, there's so much responsibility now on health systems, which again rely on facilities in the nursing home industry to provide that care, which forces us then to work more closely with physicians in the community and home health agencies that we also hand patients off to.
Wait a sec, did I understand you correctly? Did you say that nursing homes are looking to take care of a member for about 90 days to really evaluate them totally instead of rushing them out the door right away?
Yeah, no.
Is that what
so
you indicated?
No, so our patients typically on the short-term side
Yes.
will stay with us no more than 30 days.
Oh.
That would be considered a long period of time.
What did you mean about 90?
So hospitals are held accountable. If you're a patient today and you go into any of the city hospitals because you had a heart attack, God forbid, and the hospital takes care of you for 5 days, they then will move you along, most likely into a skilled nursing facility where we will care for you for perhaps another 20 days.
Okay.
At that point, the clock doesn't stop ticking on our responsibility that we have with the insurance companies and Medicare and a lot of the Medicaid systems that we work with. They are holding us accountable as caregivers to make sure that we are not only, there is no more discharge mindset. It's transition. It's how do I get you
Oh.
into the community, but not
Oh.
forget about you.
Oh,
And
I
there's-
love this. Listen to this, viewers. This is good news for
Yeah.
families. I love what I'm hearing. And so how do you affect that then?
So we just like hospitals hold us accountable for how we take care of their patients and what type of linkage we maintain with the hospital, we now have to do that with home health providers. And more often than not, have to link up with physicians in the community who can also take care of these patients who are being sent back back home. And for the patients that stay with us on a long-term basis, it's the same thing. We have a responsibility to make sure that we are not sending them in and out of the hospital 3 times in a month. And certainly, I know David manages that on a daily basis with his counterparts around the city.
It's hard. It must be this is very hard situation for you to deal with.
It's great for the families, though, and great for the patients, so there's a lot of.
Actually, just to jump on that as well, One of the things that the nursing homes started to realize, I mean, like I said, before we were doing that nursing home scenario where you had 80, 90 admissions a year, that they're doing now 400, 500, 600 admissions. What ends up happening is a lot of these patients come back a year or 2 or 3 later. So what ends up happening is, what started off, we're dealing with an elderly population very often. It's a sick population, and today it may have been a fall, and tomorrow it may be a stroke, whatever the case may be. They want and have to do a good job so that the person's going to think about returning to their facility as opposed to going to a different facility.
Competition.
So
Absolutely.
that forces the industry, and I think,
The competitive nature, for sure, of our industry today has really, it's benefited the resident, benefited the consumer. The fact that, we try to open our doors and we try to really have, this total approach for our residents to, for their ultimate care, even when they go home. A lot of times, they become so attached to us, or they become so attached to a therapist or to a nurse, that even after they get home, we're still making the phone call. How are you? How's it going? Come back to the facility. We're having a program, today. We'd love to see you. And that relationship that we're developing with our residents and within the industry, really, almost
Oh, I
everyone,
love what I'm hearing.
It's really a wonderful thing, and it really creates, a better environment, a better, outcome for the consumer.
It's more of a community sense, and I'm getting a sense that it's more of a
100%. A lot of-
community goal here to keep them, to be totally encompassed. And also, by the way, we take our dog to the nursing home where my mother-in-law is right now, and they let us in with the dog, and the dog visits with the different patients. Do you let animals into your places?
I've seen animals in my facilities I had no idea even existed.
Oh, it's so good for the seniors. They love
Yeah.
it. They love it. How about yours?
100%. We always have, we have something called pet therapy.
Yes.
We have a small pony that comes and dogs that
A
come.
pony?
Yeah,
A pony to
sure,
the nursing home?
sure.
In New
It's
York
there.
City, in
In New
Brooklyn?
York City, in Brooklyn.
Yeah.
100%.
Wow, that sounds
100%.
great.
Yeah, these are, again, we're here to really make the consumer understand that it's not a nursing home. It's a rehabilitation center. It's a life center. It's a place where you can grow spiritually. There are tremendous amount of opportunities there to meet with psychologists and doctors and nurses, and really become one within the facility. And we know that we're a community center right now. The community that we're in, we try to open up to that community, as well. I know that several times when there was a heat emergency or in town, we became, those areas, those, cooling centers.
Oh, yes.
A lot of times when there's a, we want to make an event, a parade outside, a concert outside, we do it for the community. We recognize that we're just an extension of the community, and we appreciate, what the community does for us, and that's what we're trying to do.
Great. Well, thank you, panelists. We have about less than a minute left, and I was wondering if there's anything else that you wanted to share before we close to share with the viewers?
Yeah, I would just say that, next time a physician or a nurse or a case manager tells you that the nursing home is the next step, think of it differently. We look at that as the opening the door to the next step to get you home.
I think that it's like, again, I agree with Steve 100%. I think that hospitals are a scary place. Nursing homes are a scary place. It's always, no one wants to be, in a hospital. No one really wants to be in a nursing home. But I think that if a family member and the resident understands that this really is this is a good place. It's a place where I can get stronger. This is just another, just a step, to getting home, to getting back to the community, to getting back to my life. And they embrace that, and they seek our care. I think that, most people would feel very comfortable about that.
Terrific. Thank you so much, panelists, for participating. Thank you, viewers, for watching. You can view the show every Tuesday night at 8 p.m. on Staten Island on Channel 34, and we also air in Manhattan and Brooklyn. We hope to see you again. Thank you so much. Bye-bye.